is a scanogram of an HRCT. Please observe that left hemithorax is relatively hyperlucent as compared to the right one. There is consolidation here, but even then you can make out that left side of the hemithorax is relatively hyperlucent. This is a case of Macleod syndrome. Now I will show you the HRCT images. These are the discrete nodulostriate shadows suggestive of previous tuberculous infection involving apico-posterior segment of left upper lobe and apical segment of left lower lobe. These one here. At places there are nodular calcifications as well. First, I will brief you about the left lung. Please observe that left hemithorax is almost of the same size. There is no significant mediastinal shift. However, it is very hyperlucent as compared to the right one, and old tuberculous lesions are present in the apico-posterior segment of left upper lobe and apical segment of left lower lobe. Now please come on to the right side. Now just compare the differences between the sizes of the pulmonary arteries and perfusion on both the sides. These are the mnemonic consolidations. On right side, mnemonic consolidation has involved the anterior and posterior segments of right upper lobe and both segments of right middle lobe and apical segment of right lower lobe. Please observe that right hemithorax or right lung is more vascular. The lumens and the diameters of the blood vessels, they are much more as compared to the left one. I wish contrast enhanced CT scan was done so that actual blood vessels and their sizes could have been properly visualized and appreciated. Now this is the mediastinal window. Unfortunately, since it's a plain CT scan, but even then you can just make out this is pulmonary trunk here. Please observe that this is right pulmonary artery. Please keep its size in mind, and this is the left pulmonary artery. There is quite an obvious difference between the sizes of both the pulmonary arteries. There appear to be small lymph nodes in right infrahilar region, which probably are obstructing the right upper lobe and middle lobe segmental bronchi, resulting in pneumonic consolidations. But these would have been much more clearly appreciated if a contrast enhanced CT scan was available. Now please observe again the differences in the perfusions of both the lungs, sizes of pulmonary arteries and paucity of blood vessels on left side. These findings are typical of the Macleod syndrome. This is the coronal scan. Unfortunately, patient couldn't hold breath for this long, so there is slight blurring because of the breathing movement.